I didn't show up late.
I think we're going.
Okay.
Yeah,
All right, good morning, everybody. I'm going to call this meeting of the Richland County Community and Health Services Standing Committee to order. Miranda, can you roll call, please?
Great. Miller. Miller.
Oh, she is on. Mary, can you hear us? Looks like you're muted at the moment. Okay, well, maybe she.
Kramer.
Here.
Engel.
Here.
Glassbrenner.
Here.
McGuire.
Here.
Barris. Braithwaite.
Here.
Chicker.
Here.
Oh.
Madam Chair, do you want to recognize Mary Miller as being in attendance or no?
Let's wait and see if she's able to join by, or maybe she can put, Mary, if you can hear us and you can't get unmuted, maybe put it in the chat. Do we have?
You have 6 without Mary, so you are fine.
Okay. Great. We are in compliance with open meetings law.
We are.
Okay. We have an 11-point agenda today. I have a motion for approval of that agenda.
I'll second.
Larry and Sandy. And approval of meeting minutes from the July 3rd meeting, which was our 5 p.m. public hearing meeting. Any changes or corrections noted to that? All right, we'll declare those approved. Moving on to number 6, public comments. Is there anyone here or online who wishes to speak as a member of the public? Okay, that takes us to number 7A, child support updates.
Good morning, everybody.
Morning.
I do appreciate the agenda being moved around a little to let me go first. As a small office, our time sometimes comes at a premium, so. All right, so, in your packet, you'll see that I have our performance measures are from April to June, so my report will be as of June 30th. For paternity establishments and court order establishments, we are meeting or exceeding the benchmark. Collection of current support, we are falling just a little bit short. And arrears collection, we are gaining ground. That's the one that starts at 0% each year. And by September 30th, our goal is to hit 80%. So right now we're at 75.72. So we're on track to hopefully hit that 80%. I will note at some of the directors meetings I've been at, it has been reported from other agencies that child support collections has been a struggle. This is across the state. There are very few counties who are meeting the 80% benchmark. Right now, the statewide average is 74.57%. I think there's only a handful of states who have actually hit the 80%. A lot of it just has to do with the economic climate. But we do what we can and try to hit that benchmark. We are currently 18th in the state for arrears collection, so that is good, out of 72 counties and tribal agencies. And then the state average for arrears is 63.88%. So we're almost 12% above the average right now. For staffing, we did hire a new employee. Unfortunately, she's not here on Thursdays, otherwise I would have brought her to meet you. Her name is Jacqueline Hill. She will be she's a part-time clerical assistant, so she'll be offering office support to Charlene and I, and hopefully that will allow us some more time to focus on more of our case management, and then allow me a little more time to focus on the responsibilities as the director. So she is budgeted to work 15 to 20 hours a week. It's a non-benefit position. The best part about hiring her, she is actually a certified Spanish interpreter. So she will be able to assist us with our Hispanic speaking participants, which has been probably one of the biggest challenges in our office. I know about enough Spanish to ask them if they need an interpreter and get a phone call. So, and then I have some upcoming meetings and trainings in September. There's a 2-day directors dialogue in Madison that I'll attend. The directors from all the agencies in this area of the state get together. We kind of brainstorm and share best practices. And then in October is our annual Child Support Enforcement Conference. Myself and Attorney Forehand will be attending that, and it's in Appleton this year. And that's a 3-day conference. So for the budget, our budget reports are as of June 30th. As of June 30th, we have expended 55.97% of our expenditure, or I'm sorry, that's what's remaining of our expenditure budget. So we're on track for where we want to be this time of year. The reimbursements on that report look low because we claim monthly, but we only get paid quarterly. We did receive our second quarter payment on July 31st, which obviously won't be reflected in this because this is June 30th, for an additional $56,823.05. So as of today, we have received 81% of our projected revenue. Just a little caveat I want to put out there. So the amount that you see for our projected revenue, we have the potential to get more than that. When we do our budget each year, we calculate up, we get reimbursed by the state and federal government 66% of what we spend in our budget. We also have the opportunity to earn incentive payments. So that's meeting our performance goals. There's some other incentive goals that the state and federal government have set for child support agencies, but because that is not guaranteed revenue, we do not include it in there. So some of what we've received already has been some incentive payments. But right now we are on track to receive what we've estimated for our revenue as it is in our budget report. I just don't want you guys to say, wow, you've already received 80% and that's only at the end of June, because some of that is incentive payments. And then I have been working with Trisha and Derek and Tammy on our preliminary budget. We still have a few tweaks to make on it because the judge is looking at changing some things with the court rules and how our court hearings are handled. Having the family court commissioner hear more of the child support cases to free up time for the judge, so then that in turn changes what our budget looks like. So we're kind of just working through that as we get more information from the judge. We did have our triennial review just last week. It was my first time doing that. It went better than I expected. Let's say that, for me not knowing what I was doing with it. So it's held in 2 parts. So the first part we do is virtual. The reviewer goes over our caseload, our performance, talks about what are our successes, what are our barriers, have we completed our required training that the state government requires. And then second part was last week. She actually came on site. They go through, we follow IRS compliance. We have very strict guidelines that we have to follow, and so that is to ensure that we are following those guidelines. She writes up a review and gives us either recommendations, which is stuff that we don't have to fix, but it would be a good idea to fix, and then also findings of non-compliance. We did get a couple findings of non-compliance, and some of those were just the fact that as a new director, I had absolutely no idea it was something that we were supposed to be doing. So I'll receive her report in a month, and then I have a month after that to fix those. And I already have half of them fixed already, because why wait? And then just the last note, it was not on my sheet because it came out afterwards. August is Child Support Awareness Month. So Governor Evers issues a proclamation every August recognizing county, state, and tribal agencies, along with parents, caregivers. This is also the 50th anniversary of the child support program. Just to give you a touch of data, in 2024, nationally, 12.2 million children were served by the child support program. And Nationally, $29.5 billion was collected by child support agencies. So me personally, I would like to thank my staff, even though they're not here in the room with me. They put in the work with me every day. I want to thank you guys. I want to thank the county administration and I support our agency. So, and that's my report.
Well, thank you for the
Thank
work
you.
that
Do you guys have any questions?
Any questions? Melanie? Great. Thank you very much.
Thank you.
Okay, 7B, HHS Director, Administrative Report.
Sure. All right, so in your packet, you have the unit updates broken out by each unit. ADRC took some time in July to do their point in time count, which is where they go around and see about the homeless people, you know, do a homeless count and share resources. So that's always a nice thing that they do to share those resources. And then just a quick heads up, you kind of see in a trickle down some of the impacts of some of the changes at the federal level. So just expect long wait time when you try and get a hold of Social Security. So if you're hearing out there that people are having those struggles, that is a real thing. I made that out for the behavioral health unit. We got our certificate to be a 75/5 clinic, and what that means is it's now integrated. So instead of having an AOTA license and a mental health license, it's integrated. So that just allows us some flexibility in how we staff the clinic. No longer required to have a mental health therapist on staff at least 35 hours a week. So that gives us flexibility because that's a position we've always struggled filling. So, yeah, so that was pretty exciting. And otherwise, the behavioral health clinic had a few reviews as well last month, and we came through with those pretty well as well. Child and Youth Services, just wanted to highlight on August 14th, the Yes Kids are going to host a car wash. They do this annual fundraiser, so bring your car, get some food, and then the money they raise, they're going to donate to the Humane Society. So that's on the 14th. That'll be right in our parking lot, right across the street here. Economic support, they doing the same as they always do every month, take a lot of calls, process a lot of cases. They also had a certification, child care certification review last month that went well. They spent a lot of time talking about things that we can do as far as outreach, to maybe encourage recruiting more providers to become certified within the county, because that we're lacking in certified or licensed providers. So they're starting to do some more outreach in that. With that, it must be this the month for reviews, because public health also had their vaccination clinic review, and they passed, so they can keep giving immunizations. They were excited about that. Fall flu vaccines are just around the corner. We're starting to plan those events to get fall flu vaccines. And then they just applied for a small grant to help enhance their prevention work with tick-borne illnesses. Evan's already doing a lot of work out there, goes to different events to share prevention with that. So it's nice that we might be able to get a little money to maybe do a billboard or something. So, and so that's unit updates. As far as agency updates, just want to share all of these units. We're out at National Night Out the other night. I don't know if anybody was able to get out there. I'd never been to one. I went out there and wow, that's quite the event. Yeah, that was pretty exciting. It's exciting to see staff out there meeting groups and just, you know, socializing with the community, getting to know the community. And my last announcement, this is the most important announcement, most exciting announcement. Haley Levy. She's the new business and financial services manager, so she's is replacing me for my old position. So today is day 4, so day 3 in 2 hours. Yeah, so she's just here, to learn. Told her eventually she's going to be doing all of this. She'll be responsible for C, D, and E and whatnot. So I'm very excited to have her here. Do you want to say anything about yourself or kind of where she comes from?
Yeah, sure.
So thank you for the introduction. I'm really excited to get to know everybody and acclimate to this position. There's some familiar faces from the hospital here. But I've worked in various realms of healthcare administration previously through the Richland Hospital and also through the Sauk Prairie Hospital as well. So slightly different sectors still with healthcare at the helm. So that's me in a nutshell. Yeah, great.
Was your name Kayla or Kaylee?
Kaylee.
Kaylee, okay. Very nice to meet you. Welcome.
Thank you.
We're happy to have you. All right.
Your last name Levy. We know all about tax levy.
Yeah. It's a good way to remember it.
A lot of guys, so yes, no tax levy.
Tax levy. That's always on our minds.
So I have two questions for you in terms of mental health in the county. With Paquette closing, what's the impact of that?
It just adds to our wait list. It really is what it does.
Adds to your wait list.
Adds to the wait list. I mean, we share they have to go out because I don't think the hospital even has therapy. We still have Pine Counseling. What else is out there?
There's a couple other independent
Independence.
individuals within the community, but we really are lacking those mental health services. And so unfortunately, because we don't have a therapist, at this point either, that full-time one, it really does push them out to other communities.
We refer, put them on our wait list if they don't want to go somewhere else. If they want to wait.
Well, there's a lot of people suffering in the county, that's why I don't ask it.
So we have the
What can we do to increase our resources?
Wow, that's a great question. I mean, it's a great question. Within the community.
For years though, this community here has had a hard time getting a certified therapist for mental health somewhere where these people go.
Right.
And I don't know if it's the area that we live in, but it's just been hard for Richland County.
Sometimes what we're able to do at Health and Human Services is we're able to host somebody that is in there, try to get their hours for their license, right? We're able to host that. So we have, you can think of us as a place for people to get that experience. But at the end of the day, they end up maybe going private or whatever, and just add that to the list of independents that we refer to. So while our clinic is not fully staffed, there are.
I have a question, John. Does this affect also those people that are trying to get their driver's license back after having like DUIs or DWIs?
The intoxicated driver program? No, that's still good. Because we
Okay.
have to.
Well, there's an assessment that some of them have to go through to see if they're actually dependent on alcohol, or they can move forward to get at least an occupational license.
Because we do the independent driver assessments, those IDPs, we do those.
Okay,
Is this something that's in addition to that? Yeah, I'm
That's
still
what it
learning
is.
too as a newer director.
That's what it is.
We do those. We do the independent driver.
and they can just call your office in front, or is there a special?
No, you just call the front desk and, so.
Is the
But you
person-
have to actually have that ordered, right, that IDP ordered to do the IDP, but we do have somebody that does, from the courts.
Oh,
We do have somebody,
oh, okay.
but we do
Maybe
have,
that's the problem, because this person came up to me and asked me, because this individual had called and never received a call back. So, from your office, so I was wondering.
if it's truly for an IDP, they should have gotten, either way, they should have gotten a call to say, even if they're just seeking services, it doesn't have to be an IDP, we do have an AMP counselor. That is a position we do have filled.
Oh, got it.
I'm not really sure what kind of a wait list she has, but.
Well, maybe if I can get with you after the meeting and give you this individual's
I can do some
information.
follow-up.
Yeah,
You bet.
if you would, please.
Yeah, I could.
Thank you.
At the ARDC meeting yesterday, we talked about the impact of the budget bill on the ARDC. And we don't know until 2027 right, was implemented. But we did have an indication of a rise in the loss of insurance for individuals and food from staff. So I'm wondering what the implications are for the budget bill on health and human services. What are the areas that we should be looking at?
Could we,
Get cut?
if I can just make a comment, perhaps we could make this an agenda item or something that we could discuss, unless there's something brief that you have for,
Maybe the
I just
brief
don't want to
one.
get too far on.
What's that 2026 budget in here, and I can maybe speak to it a little bit.
Yeah, let's do that.
With the 2026 budget.
Okay.
But if more details, if you want more ideas, I have to bring that. In the future, I have to bring some ideas.
It'd be nice to get it.
Yep, sure, but I can speak to it a little bit. That works.
All right, so we have expenditures report for C, and then D is the budget summary. Expenditures report is usually just a look over in your packet. Was there any comments or anything that you thought was significant?
I looked through it and there wasn't anything that really jumped out that isn't standard expenditures.
Unless the committee has questions on C. So then budget summary and county placement report.
Sure. So for 2025 so far, this is through the end of June. And we're at total utilization of 49%. 50% is kind of where we would like to be. So we're there, right? But you'll see that there's a couple of, I thought I had fixed the adult protective services one, because I had to do an adjustment for some expenditures that were hitting the wrong account, and I see I didn't fix that on this particular report, but it's technically not under, it's just,
Okay.
it's somewhere else, it's in another location. So that's why it's kind of nice to see the average, and the average we're good. And children with disabilities and CCS are high, but of course we're trending really high this year. Those programs, a lot of referrals in those programs. Our Winnebago and Mendota is 112,000 this year. That's not too bad. That's pretty low compared to some other years. Anticipated revenue, that's just me throwing in there, putting in there all of my different claims that I have pending, that the revenue doesn't show up. So I'm reporting June expenses, but I won't get the revenue until August 1st. So that's me just trying to let you know that there is revenue that's expected. And then we are trending a little in the negative there. But again, I'm not too concerned about it. There's a lot of year left. There's some revenue that I budget that I'm not necessarily have in here yet, like wind curve. I have nothing in here that indicates what kind of wind curve we could anticipate. Wind curve in Wisconsin, Medicaid cost reporting. Just gotta learn the acronyms. So,
Don't you give her the acronym
Yeah,
list
I
that we
did.
have, did you?
that was in my packet. So there's a few things I don't have reflected in this, so that would adjust that a little bit. And then we do have one high cost placement that actually runs through CCS, that traditionally middle of the year, we kind of start moving from this particular Fund 56 report and start running it through the placement report instead. So that could be a little bit of that as well. So just where can we afford that? Is where that may be adjustment into it. I'm not too concerned right now. See our expenditures are on tracks. Questions about the budget? Summary. Placements, for the adult placements, as you can see, we're at 21%, so which is wonderful
Good.
news. Like I said, Winnebago, Mendota stays have been, knock on wood, fairly low this year. We've had, not that we haven't had the numbers, we've had a lot of numbers.
I was gonna say, I know
Numbers
we're
are
like
really high.
trending really high, higher than last year.
The numbers are really high, but we're able to find placements for them that aren't
Great.
necessarily as expensive as
Yeah.
Winnebago and Mendota. But we've been using Miramont quite a bit, so they're cheaper. Or I should say cheaper, just more, they're cheaper. I guess, I don't know.
More cost effective.
They're more cost effective for us, so yeah. So that's, we're doing well there. Yeah, definitely. And Miramont, actually, we went and checked because we hadn't gotten an invoice all year, and somehow they've been able to, I'm not sure how they've been able to do it, but they've been able to get coverage through insurances. And
Wow.
things like that, which is really nice. We really try to stay on top of that, making sure that insurances are getting billed if they can be, right? Children's placements, they're at 42%, but what's exciting about that, and I think I've reported in other months, of those placements, they're not in the placements anymore. They've been either reunified with family or we've been able to find places for them that aren't the high cost places like the Chilitas, all that kind of stuff. So while it's at 42%, knock on wood, as long as we don't have any of those the rest of the year, that'll obviously level off, and that fund should come in pretty good as well. So, okay.
7E is 2026 Health and Human Services Budget Update.
So this is the summary that I put together. I'm sitting here looking at child support do their budget, and it was one sheet, and I was like, oh. Yeah, ours is a few more than one sheet, so I pulled it together as a summary, so you can have one sheet. Couple of things, we were given the directive, and that's actually just a caveat, this is my second summary. My initial summary that I presented to the county administrator and county clerk, I was told to take it back and make some changes, so I was able to make those changes before this report out was due. So this is a reflection of my second attempt, my second stab at it. And knock on wood, I haven't heard anything back to make any other changes yet. Have a couple of tricks under my sleeve if they ask me to do that, but I'm hoping that this is what will be final, fingers crossed. The main thing that we had to do with our budget this year is, you heard the county administrators trying to move everybody off the step, right? So with that, I had to do this step for everybody throughout the agency. I had to do, which then increases our retirement and increases FICA. And then we also were asked to budget 11.2% health insurance increase. For our agency, that total increase is $207,000. So just to kind of give you an idea of building that in was a challenge. So then what we ended up doing, the managers, they all took a stab at their budgets as well. And we looked at all kinds of things from the vaccines in the vaccine clinic. We traditionally budget 10,000, but we're always returning. So do we continue to budget 10 or do we budget 7? So we did things like that because we knew this 207,000 was going to hit fairly hard. So all the managers worked really hard to kind of come up with some other adjustments we could make. So you'll see that in some of the units, there were decreases in the expenditures. And that's why, because we were able to kind of, the goal was to at least keep expenditures as close to the same as possible, knowing that the revenue is flat, right? To speak to the changes coming down, we budgeted revenue based on basically cost to continue, right? We weren't told that there was only 2 spots where I was told that funding was being cut. Definitely cut. Otherwise, the rest of it is like, we're not going to know till late 2026, early 2027, where that's going to land. I haven't heard anything. So knowing that there were these cuts, so for like public health, we have our fund 340. Well, I have it on here as 34. I got to change this number, but for fund 34, we were told 25% cut, right? So there's no levy in my fund 34, so I had to take those expenses that we would put into fund 34, put them in fund 56. Public health is tax levy. So while we made some changes in overall expenditures, I needed more levy in public health, so, you know, it's kind of disappointing, but it's what we had to do. And then the other area where I, had to cut was economic support. That was big, to keep that levy status quo, so we're not putting more levy into that. What they did in economic support, that's the second cut that I definitely know about. Fourth quarter 2026, currently the feds give us 50-50 match back, right? So if we go over our allocation, we're over this 153,000, we'll get 50 cents back on the dollar, right? Starting in fourth quarter 2026, that goes to 75-25, right? So for every 75 cents, we'll get 25 cents back, which is unfortunate. So then in order for me to make that work and not ask for more levy in that particular line, and this was an agreement, this is actually, there's a resolution way back from 2015, that if we have to start asking for more levy for economic support, then positions will have to start to be cut, right? The good news is there's usually quite a bit of attrition in economic support, unfortunately, because it's a hard job. But there is a vacancy. So what I did is I just said, we're just not gonna fill that vacancy in 2026 is what we're gonna do. So not eliminating the position, whatever. So yeah, so that was something that those are two things that I definitely know are cuts that are coming, but the rest of that, we just budgeted cost to continue. I haven't got anything that says my base county allocations are reducing, or any of those other pots of money. I haven't had any feedback that anything's happening. So, let's see. Speaking of base county allocation, so we get about $500,000 in the children's unit, $500,000 in behavioral clinic, base county allocation. So even in the children's unit, you see that there is a levy ask that we've never asked for before. And that again is just, so, you know, based on some estimates, we did make some cuts as far as the mileage that they thought they might use throughout 2026. They have heavy. We've started to use an agency vehicle, so we're seeing that go down. The cost to use the agency vehicle is definitely more cost effective. So there's that. And then let's see. Through the track here. In behavioral health, yes, we do. There's quite a bit of increase in the behavioral health, really tied into crisis services. We were hoping to get added APS crisis position that was taken out.
Say that again.
An APS crisis position we had hoped to add. We're asked to take that out, but we're looking into instead increasing maybe our Northwest Connection contract. So I kind of came up with sort of a good number that would increase it without increasing it too much. But just in general, some of these programs, because of, again, back to this step increase, health insurance increase, what happens in behavioral health is they eat up more and more of that base county allocation. Base county allocation is a pot of money that you can really pretty much use for anything across the agency. So historically, administrative services has utilized that just to keep support staff in the building, fiscal staff to process billing and those kinds of things. But as those costs increase in behavioral health, that's less base county allocation that move around. So again, so more levy asks for an administration. Back to the ADRC, we were able to we tried to ask for some levy in the ADRC to make some changes over there, but we were asked to keep that levy at 0, so that's what we did. Elderly services, we did ask for an additional levy in the nutrition transportation program, specifically nutrition, because they have a nutrition ban that's pretty much dead. So they definitely replaced that. So we did keep that in there. The levy asked for that increased a little bit. But I think I'm kind of pretty proud of the fact that, with a $255,000, increase in salary and fringe, I'm only asking across all our funds, well, except for placement funds, I'll talk separate, asking for a $76,000 increase in levy, so, which still is not the same amount of levy we had, increase, $76,000 increase, which is still, we're still under the levy that we've had back in 2021. So, but it's starting to creep back up again. So we made huge cuts 2 years ago. It's had to start to creep back up again. As for the placement fund, I did not ask for any additional placement fund dollars. We want to keep that in there. So even though we're having a great year, you just never know. One high cost placement could just eat that right up. So yeah, we almost had one that was going to cost us 1.6 million. So it ended up not good, but it just kind of gives you an idea of. I don't have I only have 1.3 million in both my placement funds, so that would have been awful, but it was averted and good. But
I'm just seeing on the chat that are they able,
that was scary.
that was Mary, but Brandy said she couldn't hear.
Oh,
Brandy Anderson, I thought. Can you guys hear online? Somebody respond if you're hearing okay.
I can hear just fine. This is Cindy.
You can hear?
Yes, I can.
Ingrid, this is Brandy. I can hear now.
Oh,
My issue was fixed.
okay,
okay.
great.
Thank you.
Thank you.
Wow. I thought I was talking loud, but sometimes with my back to the microphones, I don't know.
So it's impressive summary, impressive management, balancing. It sounds lean and anticipated to get leaner. What I hear.
I don't know. I don't know.
Right, and I feel like this is a constant up and down that we have. I mean, a few years ago, before the shared revenue increase, we were in a very, very tight spot where we were talking even more major cuts. So I don't know, I just feel like over it goes up and down and yeah.
Down and down. So yeah, but you know, I don't think it's awful. I'm hopeful that we won't have to cut that. I would have thought, knock on wood, maybe I would have heard by now if I needed to.
To cut what part?
I would have heard if I needed to cut more
Okay.
now, if I had needed to.
When did you submit it?
My meeting was July 24th, I think.
Okay,
And I think it goes to executive finance next week, I think. The preliminary results.
okay.
I'm hopeful. Like I said, I got a couple tricks on my sleeve. I love Winker. It's wonderful.
As long as it's a good one career.
As long as
It
it's
could
a
be
good one
awful
career.
too.
So, but you know, I found an old summary when we were told to make those cuts back in 2022. It was. And Trish was first on board, and I actually found an old summary of some of the stuff that her and I had.
Yes,
Some
I
things
remember that.
Some things we had thrown at the wall back then. So I still have that, believe it or not. I showed it to her. It was just chicken scratch.
That's like the apocalypse. That we might have to.
So
Let's hope we don't have to go there.
hopefully we don't have to go there again, but, and I have to say, you know, I think we all really look at every time we have a vacancy or every time we're always looking at different ways to be more efficient and what can we do if we do have to go lean, what do we do, right? And what do we do not on the backs of the staff, you know, like I said, instead of, telling staff, no, you can't have that staff, well, okay, where else can we maybe, make some changes that, don't budget just to budget. I think that's Trish and I worked really hard these years to budget. What do you need, right? Don't ask for more if you don't think you're gonna need it. We got pretty good at that. Managers are on board with that as well. Any good questions? Is there a specific assignment homework you have for me then to talk about future or?
The behavioral health stuff makes me nervous. I see that increasing.
Mm-hmm.
And resources getting tighter. So, a number of years ago, we tried to get the hospital to do telehealth, psychiatrists, and stuff, but the profit margin on mental health is not the highest. So people were reluctant as a business to move that direction. So, but that's why I'd like to struggle with that a little bit, to see if we can figure out resources for them. Do you need a motion for the budget summary, right?
No, it's just informational, so if you guys don't have any other questions, I think after it goes to finance and executive, that's just the preliminary though. There'd be another round
Yes,
and so we'll get another update at our next month's meeting.
unless there's something that you jumped out that if Trish were to come back to me with wanting me to make
Right.
some changes,
Yeah, and I don't know, I was gone most of July, so I haven't seen some of the other budget summaries, so I don't know overall how the tax levy increase is looking, because that might have an impact. Great, good, okay, thank you.
Thank you.
Number 8, we finally get to you. Discussion and possible action. Sorry, I probably could have moved that up further. Resolution approving the ADRC, applying for and accepting a 2026 Section 5310 operating grant.
So we do this every year. So this grant is it's a federal grant that comes through the state, from the feds to the state to us. It is a competitive grant. We've gotten it for about the last 13, 14 years. We are finding that more and more counties are applying for it, and so it's getting more and more competitive each year. What this grant does is it allows us to be able to support our bus program, which provides bus routes going from Richland Center out through other communities, getting people to be able to go to doctor's appointments, socialization, things like that. Grocery stores, because as we all know, we only have Walmart here, which is not real friendly for individuals that have mobility issues, things like that. And then it also supports our wheelchair transportation, taking people to on-demand to medical appointments. So we apply for this every year. The match, it can be in kind or cash match. So what we do for our match is our cash match is actually from our 8521 program, which is our specialized transportation funding that we get through the state of Wisconsin. And then also we can use revenues from our managed care organizations that we charge for our bus transportation. So there's no additional county levy needed for this. And so the grant actually would give us an extra $33,000, up to an extra $33,550 for our transportation.
Motion to approve.
I'll second.
You guys are very efficient today. Yes, this has been great. It's a great program. We need to keep it going. So, yeah, any further discussion on that? Not? All those in favor, please say aye.
Aye.
Okay. Thank you, Roxanne. That takes us to number 9, correspondence. I haven't received anything, buddy. Okay. Number 10, future agenda items. I would imagine we'll have another budget update at that time. Anything else? Was there like a specific agenda item you would like regarding or related to your question?
For the behavioral health.
Yeah.
I'm just wondering, in addition to the county, who else could help resolve this? So where does that discussion need to occur? And can the county help facilitate that? Is that a meeting with the hospital? Is it a meeting with area health providers? Is Gunderson just to? Because I see that getting worse rather than better. So to get ahead of it a little bit. I know Gunderson's going to open up a mental health unit. It's emergency in the fall for 2026. So that'll help. But
I think this is Cindy Chicker talking in, I guess, I suppose you would say. I know that both of the entities in the area, the county as well as the hospital, had mental health or behavioral health on their community health needs improvement plan as an issue on their community health improvement plans. And I don't know where those two groups are on on the progress that they made towards their plan and calling it into action. So maybe that's something, but yes, it would involve getting together with the local providers, depending on what you consider local.
Larry, would that be something you'd be willing to reach out to maybe the hospital or find out where they're at on their plan or something like that? I just want to be careful not to add too much to their
Right.
workload. But if we were able to come up with some reports back on what is happening or ideas, that would be great to add that to the agenda.
And I can touch base with Trisha when she gets back, because she might have already been involved in something that I might.
I know she
not
does have some
Be
meetings
aware
there.
of, right?
Right.
That she maybe was involved in some characters. As it's transition, that hasn't necessarily risen to my attention, so touch base with her.
Yes.
Would you like me to note that as a discussion of possible action item or simply a report, man?
Let's just do report for now. I wouldn't imagine we'd have any action at that. Okay. Anything else from anyone else? All right, thank you all. Our next meeting is first week in September 4th. Does that look right to you guys?
I may or may not be able to make that. I'll let you know if that's fair.
Yes, it is. It's a good point. What's that?
We out of town. That was-
Ooh, might be struggling with quorum.
Yeah.
Okay,
Did you say September 4th?
yes. Is this something where maybe we should push it back a week? How does that impact with, finance and executive? Because they meet the second Tuesday, so if we pushed it back a week, we'd be meeting after finance and executive. Is there things that you're gonna need to send to them?
I'll probably have a couple of grants that have to come forward, I have 10 grants. I need to- So I can't remember if that has to go, I don't think that has to go to executive finance, I think that.
Okay, well, Francis and Dan, do you think you guys could meet on the,
I'm sorry, what's that?
can you meet on the 4th? We're trying to decide if we're gonna have a forum.
As far as I know, I can without checking a calendar, but
Okay, how about you, Cindy?
Yes, I'm able to meet that day.
Is Sherry,
Let me take a quick-
Mary? Mary, are you able to hear? Is she still on?
Madam Chair, I think she left.
Okay,
She had a chat, but she was able to hear with me, so I think she left.
okay. Well, have to do some phone calls or something, but we'll leave it there for now.
Okay, I mean, that's the only thing
Yeah,
I
I
can think
can,
of,
I can meet on the 4th.
Okay,
I think it's priority.
sounds
I
good.
can confirm if that has to
Sure.
go to executive.
Okay. Okay.
But cast in stone then, no?
What's that?
Is that a lot for the 4th then?
Well, as of right now, so yeah, Stephanie. Jerry isn't here, so I could give him a call and maybe Mary. If those two can make it, then we would just have enough, I think, for four. So,
So you have 1, 2, 3, 5, 6.
yeah. Okay, so as of right now, yes, Dan.
It is locked in? I mean, we're definitely gonna do it. now.
Unless you hear differently.
Oh,
Do I have a motion for adjournment?
I move to adjourn the meeting. This is Cindy.
Cindy, do I have a second?
I'll do it.
All those in favor, please say aye.
Aye.
Thank you all.